In this video, we're going to show you the incentive spirometer. The incentive spirometer was designed for pre or post surgical patients as a breathing exercise therapy for lung expansion so they don't develop a pneumonia or an atelectasis while sitting in bed after surgery. It keeps the lungs inflated and keeps them moving. Here, I'm going to show you the parts of the incentive spirometer. It comes with a mouthpiece, tubing, body chamber, a flow breath meter, and a goal meter. For the goal meter, you have to set that based on the patient's height and weight. And then for the flow meter, you want to make sure that you keep it in the better section when taking breaths in as you're reaching your goal. For this exercise, we are going to perform it on Hal, our patient. So doctor, what would you set the goal weight or this goal meter for the specific patient based on his height and weight?
Okay, depend about his height and weight. So let's go with the 2,500 now. The first, then we will see what's going on with him.
Okay. Before performing the exercise, you want to make sure that the patient is in the proper position. For example, he can be sitting up in bed as Hal is. He can be sitting at the side of the bed, or he can be sitting at a chair. You want to make sure that he's sitting up though so he can get the full expansion of his lungs. So Hal, we're going to perform the incentive spirometer on you, okay? You want to make sure that it's right directly in front of the patient, no kinks in the tubing, and you want to make sure the good, better, and best is facing the patient's face. So when performing this treatment, you want to make sure that he takes a complete breath out. You want to put the tubing in his mouth, the mouthpiece part, sealing it with his lips, and you want to have him take a slow and deep breath. Going slow, keeping it the flow meter in the better part as he's reaching his goal. Now doctor, how often would you prescribe this to be done with the patient?
Okay, we can advise the patient to do it, for example, 4 times per day after each meal and once, the last one at bedtime, and each once he will do it from 9 to 10 to practice it to help his lung to get a good big breath.
This therapy is really important for patients, and all nursing staff and RTs should always recommend and encourage their patients to do these breathing exercises and to not forget. Thank you.